and welcome to an all-new episode of Hatching for Health. We are back on set and excited to be joined by a new organization that we have just learned about known as DreamRydes. Now, this organization takes children with cancer and their families and gives them a ride of their life, whether it be a helicopter, airplane, boat ride, some amazing things that they are doing. So now let's welcome the owner of DreamRydes, Miss Danielle Cuban-Johnston. How are you?
Good. How are you? Thanks.
I know. I was like, let me do this green. Kind of throw some holiday in there.
I know. I should have, but this wanted a pink pop.
Yeah,
for the
day. I love it. So good to have you on.
Thank
We've been talking about like learning more and kind of exploring on Hatching for Health show, so others can know about all the things that you guys are doing. But even for me, so there's so many questions I have. Like, when did you decide to found this company?
Yeah, so originally I would say this was back, I was a nurse practitioner at Texas Children's Hospital. I was a nurse formerly from about 2008, 9 when I graduated nursing school. And then since after that became a nurse practitioner in the cancer center with solid tumor and rare tumors, and was a large part of helping to build the rare tumor program over at Texas Children's with a physician there that was a great guided mentor of mine. And so while I was there, I had so many just unbelievable patients and families that I worked with. And over those course of the 4 years that I was a NP, I met some just unbelievable families. I knew them from the day they walked in at diagnosis all the way through, and all the way through whether we were able to ring that bell and actually have a remission, or all the way to the end in some cases to where it was a different life journey for them, and we had to transition to hospice, and unfortunately lost a lot of many kids in that space. And from there, I continue to think, because I love charity work. I'm a cancer survivor myself. I had Hodgkin's lymphoma, Hodgkin's disease when I was 19, and so always thinking, what can I do in the community, and what is still needed in the community that isn't currently there. And we're Houston. We're we're a large city, major city, and what seemed to be missing, I would say, at least every week, I would miss 1 to 2 patients per week that couldn't physically make it to their therapy. Because one, they had car issues, their car broke down, they didn't have a vehicle, Medicaid transportation is available, but didn't pick them up on time, or that Medicaid transportation actually offers, it's only the parent, and so it's one parent and the child. So
it's very limited. When did this start? Like, what year was this that you?
So basically, this DreamRydes actually was started in 2018. At the inception there, after I kind of started thinking, like I said, through everything when I was still at TCH. And
going through just putting into perspective. I mean, a cancer survivor personally, at an age where you understood fully everything going on, which, a lot of these children don't even know what's going on. They're just getting hooked up to all these. So you actually understood that, dealt with it. And then I guess, is that kind of what led you probably to become a nurse and then a nurse practitioner?
Absolutely. Completely what led
me. So beautiful. And I love that, when people have those personal experiences, that they, they see how much, love and just the passion that the staff has really in the hospitals. And it becomes something that, it basically fuels that passion. Yeah, and it
becomes your life.
So
your
it makes
life path.
so much. And I didn't know any of this, so it makes so much sense. Where okay, I need to do something about. I see a problem, and it's in an area that I've experienced personally firsthand. And so, in 2018, you actually said, "I'm going to start this company."
That's where the organization was really, I would say, I guess, steam rail into full effect. And after realizing those discrepancies, being whether it was the fact that the family couldn't afford to pay to park because it's $15 per entry into the medical center with no in and out access, or whether they couldn't afford gas, they couldn't get there. Again, these patients should not be in public transportation because they're immunocompromised, their blood counts are low. They shouldn't be there.
Ubers or Lyfts
exactly.
or buses or any of that.
And so even the facilitating the help, there's organizations that do help with that a bit, and they are wonderful. But there is nothing that's completely solely geared towards that. And so basically that was what I felt the unmet need was. But then at the time also, there's a lot of organizations out there, and there's Make-A-Wish, and there's beautiful, all kinds of organizations that give great experiences to families that, once in a lifetime experiences. But I really started thinking on the transportation side, what else could we give these kids other than, Make-A-Wish and different than what organizations give. And, there was a little boy that specifically loved, was obsessed with cars, and he was 4 years old and was like, I want to, his wish was to ride in a fast car. And so the wheels started turning at this point.
No pun intended.
Exactly, the wheels they started turning and turning. And then, basically the thought was, we can make this experience happen for him, and he can still have his Make-A-Wish, right? We can do this locally. Get a volunteer for this child to have this experience that he wants more than anything. And inevitably, it was about 4 days before he passed away that we're able to give this experience to him in a red Lamborghini. And so it was the family to this day, says that was the last smile they saw on his face before he passed. And so it's something that makes sense, because we're able to give these amazing experiences for these kids. But then at the end of the day, the donation side of things and the way these car owners and individuals can help, then all goes back to transportation services between all of our Texas Medical Center hospitals and facilities, Texas Children's, and then also.
I was going to say, do you kind of have to have a contract set up with those different facilities?
So mainly at this point we're working, just because the cancer center is a little bit larger in the pediatric sector at Texas Children's, so specifically work mostly with them, but also if patients are being seen at Anderson as well, we love to, if we can help in any way, facilitate getting them their Uber rides or transportations, helping them with parking chips, any way we can help, gas money, car maintenance, whatever it is, that's what these funds are for. And so that's really the premise behind it, and where this all started. And it's been a ride. It's been a whirlwind, and we've had some amazing events and amazing support in the community, and hope to continue.
I bet a lot of people that have these exotic cars or a helicopter, I'm sure it's an honor for them to get involved. It's just kind of them finding you and you finding them, right?
Correct. That's it. That's like the great part about it. It's that you actually get to meet this child, right? You give the experience to them, and why would you not? It's free. It's free of charge for for them, right? A little bit of time, and that's all. And they provide an experience, again, a ride of a lifetime for this family.
Of course. So whenever a family, is having some of these needs as it relates to the cost of, whether it's maintenance, vehicle transportation, any of those various things, how do they actually or learn about you? Is it being spoken of?
Sure. I mean, there's always, we would love to have more. Again, awareness like this is one thing, but of course we have our website, DreamRydes.org. We have, of course, social media, but then we're also linked with Texas Children's and their handbook. So
great. Okay.
All the social workers there know about the organization, so they're able to, if there's a family that would like to, have a dream ride experience and or needs the services rendered, they contact me fairly quickly. And usually we have to kind of do things very fast for some of these kiddos,
I can imagine.
And that's kind of where we are right now. But of course, awareness, it's more and more awareness, and I think that's key across the community, and gathering, we could always use more car volunteers, more actual volunteers. We are looking as far as operations too, and enhancing our operations department too. So we have a lot of opportunity for individuals to help out and actually meet these kiddos.
That's I think Jamie Foxx has a show right now. Basically about these amazing exotic cars. That would be really.
We need to.
I know. I actually
just gonna hit him up.
I know. I actually used to know him. That's so funny. I'm just speaking live on the show right now. But no, and I'm not kidding. I've been to his house and all the things with my, So I need to I'm gonna try and reach out and and maybe connect. I know. Wouldn't that be really cool?
Some shoulders.
I'm it's been a while. When I lived in LA, I'd run into him and like some of the Wayans brothers actually.
That's so random.
It was so random.
Love their
And
shows.
But now he's got this, really. That's
I
would be
briefly had heard about that.
That would be a really, really cool connection.
And that would be where we would need to be. I was like, we would love to be. That's the awareness we would love to have.
But I remember like we met at an event and my niece, at the time she's in remission now, but she was kind of just at that tail end of her treatments, and I know it's super difficult for them to be in environments. But y'all were hosting an event. Tell me about that last event, because that was here in Houston.
We've had actually 2 pretty large, I would say large scale events that we were sponsored by McLaren Fest. The first inaugural McLaren Fest was held in River Oaks District, and we were a pretty integral part of that, and we're able to give 20 rides to 20 kids in McLarens, cool. And it was just part of the whole event. We had the tents out there for the whole festival. It was an amazing partnership with them, and it gained a significant amount of awareness at that point. And I was able to get a decent database of some car owners that I had not met, which was fantastic, which was great. And then we hosted one other event with a company called Garage Ultimate they're actually out of Clear Lake, and it's an entire different array of car owners that store their cars at this facility. Really? And it was, again, 20 rides for 20 kids and a large parade followed by a fairly large fundraising event that evening where car owners from the garage were out. Of course, friends of DreamRydes were out there. We had such a great time and raised a really good amount of money. And so that's
incredible.
I love events. I love doing those things. I love being out in the community. I think that's what we need. It's awareness. And like I said, whether it takes donations, of course we absolutely need donations, but just even signing up on that list if they have a car, if they have a vehicle that they would like to have kind of in that queue, and then when that child wants that specific car, we reach out to them and or have these larger scale events where we ask for volunteers to bring their cars and give a child a ride. Of course. For larger experiences. And
you guys you're obviously based here in Houston. Are you guys in any other states or any plans to be?
Yeah, so I was just actually speaking with one of my partners recently, and so we were actually expanding out to Charlotte, North Carolina. There's a large car industry out there, exotic industry, and she is very well versed in the nonprofit sector, and we're super excited. It's going to launch come January. We're going to have I like to say a full new year ready to ride, just get kickstart back in gear again and launching. I mean, we've full force launch over in North Carolina as well, so in the Charlotte area. So we'll continue our work here. Eventually would love to expand over to the Dell Children's and Austin and over to Dallas as well. But
anywhere they've got children's hospitals that are focused on cancer patients. I mean,
exactly.
Being able to connect with all of them will, I'm sure, be the future of DreamRydes.
That is our plan. We've got big goals, but of course we need support of our people, and I know Houston has a lot to give, and they have so far, and I'm very blessed thus far to have been able to do what we've been able to do and have the support of friends, family, my husband, who has to deal with me all the time.
Yeah,
going through all these endeavors.
Your background too, being a nurse practitioner, I didn't even know all of that and all the experience that you've had working with these children firsthand. So it's definitely. And speaking of that, I know we're gonna actually bring one of the little girls that has been a part of DreamRydes, and you guys have been supporting early on during her treatment, who's in remission. She's a cancer survivor, we call it, and so we'll get to bring her on with her sister.
Really excited. She's not little anymore. She's 17.
And you've known her since
she was 10. So she was a little girl. Which is amazing. It's been a family that I will forever call great friends.
I'm sure.
They're beautiful.
So we are going to take a quick commercial break, but when we come back, we will be joined by Miss Eden and her sister Maya. Infinity Skincare is dedicated to making you look and feel your best. If you look good on the outside, you're going to feel good on the inside. Located in the River Oaks and Woodlands area, Infinity Med Spa is devoted to skincare, anti-aging, and rejuvenation. Our treatment options will help you look and feel your absolute best. The primary difference between a med spa and a day spa is that the estheticians at a med spa work under the directives of physicians and are able to offer a much more extensive list of services than they would be able to offer at a day spa. Your day at Infinity Med Spa can vary, depending on whether your focus is more directed towards treatments focused on relaxation, or whether your focus is more directed towards an outer rejuvenation. Here at Infinity Med Spa, we believe good health is a combination of inner health and outer beauty. When you look good on the outside, you feel good on the inside. If you're interested in learning more about the med spa services offered here at Infinity Med Spa, you can visit our website at medspainfinity.com. Welcome back to the show. If you have just joined us, we have DreamRydes on, and we are learning all about this organization. And one of their taglines here, DreamRydes shares the common fuel that ignites their passion to serve patients and their families during the most devastating times of their lives. And so right now we are going to be joined by one special little girl and her sister who they have made a big impact for through DreamRydes. So welcome to the show, Miss Eden and Maya Green. Hello, ladies. I love your shirt. Nice to meet you. You guys are adorable. You can see the sister love and the look. So, yeah. So tell me a little bit about DreamRydes from your perspective. I know that she was, when I told her about the show, she's like, I have the perfect girl I want to have come on, and her sister. And so tell me a little bit about your experience with them and what brought you to them.
So I was diagnosed with cancer when I was 10, and then we struggled with a lot of car things, and so Danielle heard all about it, and then she sparked her thing that she wanted to do, and then she said, do y'all want to be our ambassadors? And so then we helped her with that, and we've done McLaren Fest and Garage Ultimate, and those are the big events we've done so far. But it just helps the other kids that have cancer and their siblings be able to smile and have fun. Same as us. We enjoy it a lot, and it's just fun. I just asked Danielle today, I said, when are we doing our next event? Because we haven't done one in a little bit.
It's beautiful. It gives you, yeah, it's it gives you, something unique to be passionate about, and being in your position, you become a role model, and I think a lot of kids look up to you too. You've kind of been through it, and I know that you had a setback a few years after your admission, so I know that also, there's kids that have that same situation. You're like, I've been there, I can even help you through this, and then tying it into something that can be exciting and put smiles on kids' faces.
Oh, yeah.
What type of cancer do you have?
I'm the only one in the world.
Okay.
And so the doctors are naming it after me, but it was a bone cancer, and it formed in my right leg and my right shoulder, and it broke my shoulder bone.
Oh,
But it was all over my body, but that's the two biggest places that it formed. And then I was cancer free for 2 years, and then I relapsed when I was 13, and it came back in my left shoulder.
Okay. So originally it was in the right shoulder?
My right shoulder and my right leg.
Okay.
So I couldn't walk for 10 months.
My goodness.
Yeah.
And so sister here, you,
I
it's
carried
almost
her.
you've been through it,
Yes.
Yeah, exactly. Carried her is right. And you guys are really close in age, right? Mm-hmm. How old are you?
16.
Okay.
And I'm 17, yeah.
So it's kind of you've been going through this, being that close in the siblings.
Oh, yeah.
Yeah, what a difficult journey you've been on. So so now you're how many years in remission?
I'm 3 years cancer free.
Okay. That is awesome. So all along the way, DreamRydes has actually been, an influence of, of some of the happiest, times that you guys have been able to experience. And did you personally ride in one of the McLarens, or was that one of the events that you partook in?
Yeah, we rode in the McLarens, and we volunteered at that event too.
Yeah, they do it all. They are literally, when I say my ambassadors, they are there every single time. I'm so grateful to have been one, her nurse practitioner, and then now two.
Oh, so you actually met her while you were working in the hospital?
Mm-hmm.
Okay.
I was, yeah. We have been together since she was 10, so 7 years, all of us.
Yeah. Oh yeah.
One big happy family to say, and one so happy sometimes. A lot of tears and a lot of lot of tears and a lot of happiness at the same
Yeah,
time.
of course.
And that's the other thing too, I just kind of wanted to mention really quickly that I don't think I got to mention before, is that I think it's really important, and I know Maya too, to even speak to this, because siblings I think is a really important piece of the cancer, the cancer journey, because there's so much focus on the child that's diagnosed, that the sibling, it's really difficult for obviously the siblings too, because things change so much within the household. And so that was a big piece of this, is that I wanted to be able to give back to the siblings too, and them to have those experiences with their brother or sister that's going through this right now. And so that's even something Maya could probably speak to.
Absolutely. It's like, I don't have children yet, but it's like, I know with my sister, and like, even like when one just gets simply sick, it's like, just what the rest go through when there's like a week of the flu, and it's, so I can't even imagine, 10 months, kind of share a little bit about that time with her.
Yeah, so we lived in the hospital. We permanently moved in, and hospital rooms are tiny.
Yeah.
And so we had like a little pallet made on the floor for me, and I would sleep in there alongside my family. And I'd wake up every time my sister had to wake up in the middle of the night, and I was just there with my parents. We all comforted each other. That's all we could do. And honestly, we made the most of it being on floor 9. I don't know, we just had the best crew with us, nurses, doctors, nurse practitioners, lots of patients alongside with us. We all just made the best of our stay when you could in a hospital.
And with some of the different things, like going back to, that's obviously like the fun, exciting part, but when these financial resources are available, like what is that limited to? Is it as simple as, like coins you mentioned for even the parking, but then if they have like maintenance on a car just to get to and from, like, do y'all help with that?
We do. Actually specifically just helped a family recently that needed, her car was in the shop, and so we helped and provided 2 weeks of rental car services for her, as her child had AML, very aggressive leukemia, and so they were in and out of the hospital that she was actually admitted in the hospital, so mom needed to go back and forth because she was also trying to work, and so we provided the rental car service for the family. So there's various ways, and I like to say it's tailored towards what the family's needs are, right? It's going to be a little different everywhere, and if it's vehicle maintenance, whether it's something large, we would love to help if we can, whether it's transmission, something big that happened to a car, we'd love to help out. We'd love to continue to grow and have the big piece. We would love to have DreamRydes sprinters that are actually physically picking up patients and taking them back. These beautiful sprinters that are very safe for families, and there's immunocompromised patients, and it's a big goal. So I just want to the glitz and the glam of all the cars. It's amazing. We love it. I think everyone has such a great time, but at the end of the day, it's about giving back and helping these families that are going through the day-to-day aspect. So, I like to always tie it back into that, because that is the important piece. And once these car owners are able to hopefully drive these kiddos around, we hope that they're able to, they want to continue as donors and volunteers as well.
Yeah. Is there anything that you would like to just say to any of the audience watching, as it relates to really just your journey in general? Because I think you have a cancer named after you that no one else in the world has. It's just any kind of advice that you want to give to others.
I just think donations are a huge thing, and so like Danielle said earlier, to donate to DreamRydes is really nice, because then it helps people like us.
Yeah.
Because we've struggled in the past. Yeah.
For treatments and all that stuff.
Exactly. And is that is it DreamRydes.org? Is that basically a place?
DreamRydes, yes. DreamRydes, RYDES, DreamRydes.org, and there is a link. Of course, emails associated, so always taking emails. There's also, of course, there's a link if you would like to volunteer your ride. There's a link if you would like to nominate a patient as well. And then, of course, there's a donation link. So everything should be able to run through the website. Again, also Instagram, Facebook, It can easily find me as well, probably anywhere
Yeah.
on social media too. But
And you're Cuban or Johnston?
I was like a little bit both, Cuban Johnston.
Yeah. Which Johnson's a great last name too. It's the T in there. It's, you know, Johnson you hear so much.
Yeah.
Johnston.
Right. Yeah.
So yeah. And what about you? Is there any advice that you have, just, you know, as a sibling of having had a sister go through what she's gone through, that you might give to those other siblings?
I mean, we go through it just as much as our siblings do, just like a different aspect on how we go through it. And just be there and be strong for your sibling. That's what I really had to learn how to do. I was like, okay, yeah, I'm like, there's an emotional side and I'm emotional with her, but at the same time, I have to be like her little pick-me-up.
Yeah.
And I have to be comforting and supportive of as hard as this is. And so just continue to be comforting to your sibling, brother, sister, whoever, cousin, friend, you know, just being supportive of that person as they go through a hard time.
Yeah, definitely. And Danielle, do you have brothers and sisters?
So I am an only child.
Are you? Okay.
So it's
knowing how you went through what you went through, I just,
was,
you know, so it was mom, dad, and yourself.
So it was myself. I was diagnosed at 19 actually, and my mom was my best friend who carried me through it all. And then my mom was diagnosed with breast cancer the next year, and then actually my dad with prostate cancer the next year, and then my mom ended up actually passing away from a secondary AML, which again is that very aggressive leukemia that was caused from the chemotherapy. So it's been a world of cancer, to say the least, for my family. And I mean, more than anything, I wish that, you know, I had a sibling to lean on like they do now, and even like, you know, talking about the memories of my mom, because it's just, they're only in my head now, you know, and so it's just, it's different than, you know, the ability to lean on have someone there for you, just like they are for each other, which is, it's so amazing. Like, I love seeing this.
It's great. And I think obviously you're doing a beautiful thing. Like, you know, this definitely comes from, you know, from a beautiful heart that you have, and kind of the pain that you've gone through, and kind of putting it out there and like paying forward. So it's been awesome having the three of you guys like visit with, and I'm excited about the next event. I know that's like in the works of being planned.
March. It will be on the website. We're kind of we're discussing venues and all of that, but TBD March. Should be a pretty large one again.
Well, definitely, count us in for volunteer, you know, as well as
would
potential
love it.
sponsorship, you know, opportunities too, because that's
Thank
what
you.
Hatching for Health is here to do, basically, like, you know, share different organizations that are helping children in various ways. So we're now partners in helping each other. So I look forward to it. And thank you guys for taking the time to come here, and God bless you with, you know, continue your mission, and we'll be keeping in touch.
Thank you.
Thank you.
It's been great.
Yeah.
Thank you so much for having us. We
Definitely.
really
And
appreciate
thank
it.
you all for tuning in to another episode of Hatching for Health. We will see you right back here next Saturday at 9:30 a.m.